Hey there, it's Dr. Justin Marchegiani, and today's video is going to be on cholesterol. I get this question all the time. Does a paleo template or a paleo diet, if you will, raise your cholesterol levels? Okay, a lot of stuff we got to unpack here to dive deep in. The first thing is cholesterol even a bad thing? And then we have to go into the underlying mechanisms in which cholesterol could be a bad thing, and also what really does raise cholesterol. Again, I've seen vegans that have high cholesterol, over 300-400. I've seen that multiple times. So the research is pretty clear. Animal protein, eating cholesterol, dietary cholesterol has a very, very small effect on blood levels of cholesterol. Although low-fat diets, I've seen patients go off low-fat diets and their cholesterol levels do go up. The question is, where is the threshold in which your cholesterol becomes high? As we know, the cholesterol levels in the 70s were in the low 300s. In the early 2000s, they were at 240 or below. Now they're at 200 or below. And there's a lot of suspicion that a lot of the lowering of cholesterol levels have to do more with selling statin medications than they do with actually helping reduce heart attacks. Again, the statins, the number to treat is 99, meaning 99 people have to be given a statin medication for one person to benefit. Now, in the field of pharmacology, that's pretty low. The number needed to treat with most medications is way lower than that. So lots of people suffering from side effects, and cholesterol on the low side can actually contribute or provide a risk factor for cancer. So on the other side, we have cancer, on the other side, supposedly heart disease. So what does it mean? So first off, what is cholesterol? Cholesterol is a building block, right? When we look at our adrenal hormone cascade, cholesterol sits up top, and it can actually be converted downstream to all of our different hormones. So it's our hormone building block. On one side, it can go down over here to progesterone, which is a female hormone. A lot of women who have PMS, they actually typically are converting their progesterone downstream to cortisol. So cortisol is another hormone. It's our stress hormone, gives us energy and also helps us deal with stress. On the other side, we have DHEA. And DHEA is a building block for our estrogens, and even some progesterone gets converted from that. And then we even have pregnenolone, which can go over to aldosterone, our mineral corticoids. So you see that cholesterol is an important building block for downstream hormones. Now, what stimulates cholesterol synthesis? This is really important. So the enzyme that a statin medication like Lipitor, etc., what that enzyme that statin is actually blocking is called a hemomethylglutarate CoA reductase. That's HMG CoA reductase. And what statins are doing is they are an inhibitor. They are an inhibitor of HMG CoA reductase. So what that does is that enzyme actually goes to the liver like so. It's our liver. I'll actually make it look more like a liver. I can do better than that. So this is our liver. HMG comes over here, it talks to the liver like so, and it tells the liver to make more cholesterol, and the liver responds by pumping more cholesterol out. So you can see HMG, and what statins do is statins come over here like so, and a statin inhibits this. So statins would block. And they decrease this HMG CoA reductase enzyme over here. So it's inhibiting it. So the question is, if the statins block this, the only problem with statins are the downstream benefits of cholesterol. So you can see with cholesterol, if we're blocking this whole HMG pathway, we also have a whole bunch of other things called your mevalonic acid, your mevalonate pathways, and these are what make CoQ10. So we have a lot of the building blocks for CoQ10 happening downstream, and statins block a lot of that from happening. Now, what are our natural CoA reductase inhibitors? So statins do it unnaturally, and what they do is they cause this decrease in CoQ10, down at the very bottom of this cascade. Not a good situation. But what are things that naturally block this HMG-CoA reductase pathway? Well, before I go into what's blocking it, what's actually stimulating it on top of that is actually insulin. Insulin is a powerful stimulator of the HMG-CoA reductase. So HMG, right? Insulin will actually go and it will hit this and it will cause the exact same issue. It'll cause more cholesterol. And this is the mechanism in which we see lots of vegans or people that aren't eating animal protein. We're seeing them with high cholesterol levels, right? Why is that? They're not consuming it, but they're consuming high carbohydrate, which can go to the liver. This enzyme is stimulated and can tell the body to make more cholesterol. So a lot of my patients, one of the first things we do is we put them on a low carbohydrate diet. What a low carbohydrate diet does is it takes the insulin down, because insulin's primarily going high because the carbohydrate is increasing insulin, right? Carbohydrate, basically when we're taken in, our blood sugar goes up, and then because of the high blood sugar, our pancreas has to shoot out a whole bunch of insulin to bring that blood sugar back down. So by just cutting out a lot of the refined carbs, the grains, the starches, and going to more vegetable-based, non-starchy vegetables and low-sugar fruits, and having healthy meats and healthy proteins and fats, we can naturally decrease the insulin, which can actually have an effect of decreasing cholesterol. Now on top of that, it's a seesaw. So insulin stimulates this HMG-CoA reductase pathway. So insulin stimulates the more cholesterol, but glucagon, which is the opposite side of insulin, glucagon actually does the opposite. So if we'll look here, I'll draw this in green. So lower insulin levels, right? Decreasing cholesterol, just like that. Well, the same thing with glucagon. When we increase glucagon, glucagon does the exact same thing. It comes over here like this, and what that will do is just like so, it will tell the body and it will decrease cholesterol levels naturally. When we do it naturally, by balancing our hormones in the right state, by having a healthy diet, cholesterol naturally seeks a healthy level. It's when we take medications that can knock it down artificially that cause deficiencies in certain nutrients later down the pathway, that's where there's an issue. So I have multiple patients that cut their carbohydrate. When they cut their carbohydrate, insulin drops, okay? Insulin drops. When insulin drops, we have less HMG-CoA reductase activity, so cholesterol falls. We start taking in more protein and more healthy fat and lower sugar. Again, protein is going to stimulate glucagon production, so we have an increase of glucagon, right? So this is basically taking it and is acting like an HMG-CoA reductase inhibitor. Okay, insulin is acting just like a statin would, so is glucagon, without all the side effects. This is great. This is a really, really good thing. So lower insulin, higher glucagon, that actually causes more natural HMG-CoA reductase inhibition. Where if we're eating a whole bunch of carbohydrates, that's actually going to cause more activation of the liver to make more cholesterol. And again, the big thing that we're looking at here, when we talk about cholesterol, we're talking very much in general, just general terms. But we have a couple different kinds of cholesterol. To keep it really simple, I'm going to do a second part to this video where we actually look at a patient's post or pre and post labs when we do a particle size test called a VAP, or a vertical auto profile. And we have particle size A, and we have particle size B. So how I have my patients remember this: A, you want an A on a test, right? So A is good, right? B is bad. So B bad, okay, A good. Now the A particles, right? These are our large, buoyant, fluffy particles here. Let me draw that out. These are our particles that are super fluffy. So think of like a big cumulus cloud. Big particles, and when they go in your bloodstream, here's your bloodstream like so. They're inside your bloodstream like so here, and they're nice and fluffy, just like that. Now the issue happens when we have the bad ones, right? So this is our A, and what happens with our bad ones is we have these small little guys here. These are our small little endothelial particle size B, and because they're so small, they can get into our endothelial fissure. So imagine we have like a little endothelial fissure or a little crack or a small little crevice in the blood vessel. Because that particle size is so small, it can go right into that particle size and it can wedge in there and it can create a foam cell and it can grow and get bigger and bigger and bigger over time and block that whole entire vessel there, that whole vasculature. So how we shift to make more particle size A is 1, we avoid the refined carbohydrate. 2, we're avoiding the trans fats. 3, we're avoiding inflammatory foods. Okay, what causes the increase of Bs? The exact opposite: inflammatory foods, trans fats, and lots of refined sugar, especially fructose. So you can see the difference. Particle size A, good, large, buoyant, and fluffy. Particle size B, small, getting stuck into these endothelial fissures, creating foam cells, creating inflammation, and then creating blockages. And all a blockage in the heart, that's a myocardial infarction, heart attack. Blockage in the lung, pulmonary embolism. Blockage in the brain, stroke. So wherever that blockage is, there's different names. And part 2, we will review lab tests and we'll look at some pre and post. So the goal today, what's cholesterol? Building blocks for hormones. How cholesterol is synthesized, right? Insulin causes more cholesterol. We lower the carbs, lower the sugar, more protein. We make less cholesterol naturally. Cholesterol is only a problem if we're inflamed, right? We'll have more Bs, more small cholesterol that will get into the endothelial fissures and create more blockages. Particle size A, bigger, fluffier, less problems. So cholesterol isn't this one size fits all type of answer. We'll go into a part 2 where we actually look at clinical lab work. And if you're having an issue with your cholesterol or your hormones and you want to dig deeper, feel free and click on screen or reach out below. Thanks, this is Dr. J. Have a great weekend.